My name is Professor Mohammed Amin Chinoy. I am one of the founding members of the Indus Hospital. Currently, I am an executive director and member of the executive committee. My current job is as a executive director of the Physical Rehabilitation Directorate. Besides that, I am also an orthopedic surgeon. The challenges that we are facing are multi-pronged. One is the big challenge of being able to provide quality healthcare across the spectrum, so medical, surgical, orthopedics. And when we talk specifically of orthopedics, then we are looking at a very small number of orthopedic surgeons, probably around 1,500 members of the Pakistan Orthopedic Association currently, with a population of over 220 million. Again, we started this department. Initially, there were 2 of us. Now, currently, there are 5 orthopedic surgeons in this department. So, one of them actually looks after trauma. We have a dedicated hand and upper limb surgeon. We have a dedicated tumor surgeon, especially pediatric tumors. And we also look after joint replacements, both the hips and the knees. So this is the current scope of the orthopedics that we do here. Obviously, when we talk of pediatric, we have a very big program, I would say an international level program that we are running here, which is the treatment of clubfoot. Besides, as I said earlier, because I look after the physical rehab. So we have got 4 physical rehabilitation centers. The first one was established here in Karachi in 2015. Then the second was established in Lahore, then Muzaffargarh, and finally in Badin in 2019. Wearing different hats at various times, there are various things that I would want to do. So let me start with the easiest one. The easiest one, I would say, is the rehab center, where I would want that we start providing even better quality prosthesis than what we are doing right now. So currently we are using the ICRC technology, and obviously technology is advanced so much that one would really be looking into sensors and artificial intelligence and computers and robotics to be able to provide that level of sophistication for our patients. The second hat that I wear is the orthopedic surgeon. Obviously, as I said, I would want the department to be having all the subspecialties that I mentioned earlier. So I want a dedicated hip arthroplasty surgeon, a dedicated knee arthroplasty surgeon, a dedicated revision surgeon, a dedicated sports surgeon, dedicated pediatric surgeon, dedicated spine surgeon, and so on and so forth. So probably I'm looking at a department with 8 to 10 consultants looking after various things, and a department that is functioning 24 hours to be able to provide acute trauma care. I had polio when I was about 1.5 years old. I would say that I was one of the very lucky ones, that despite having a disability, I had very good support at home. My parents looked very well after me. So my schooling was with normal children. I used to play, run, jump, do anything that I wanted to. And actually, I played football, I played hockey, cricket, squash, and I can still probably climb walls, which a lot of people still would not be able to do that with their able bodies. So I was one of the lucky ones that despite my slight physical disability, I did not have much of a challenge. And that is what I wish for, that all my patients coming for orthopedic treatment at the Indus Hospital, and those who are coming to us for orthotics and prosthetics in the physical rehab center should get that level of care, that they are able to be functioning as independent bread earners and uh, very useful members of the society.